In the interest of community service, Power 88 presents live talk shows to inform, enlighten, and to stimulate thought and dialogue. The views expressed on this program are not necessarily those of the staff and management of KCEP or the EOB. Now sit back, relax, and enjoy the program. Or call in and participate at 647-3688. Funding for community partners for better health on KCEP Power 88 is underwritten by the Southern Nevada Health District. And here is your host.
Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I am so excited for today's program and the amazing guest that we have in studio with us today. I'm your host, Will Rucker, and this is going to be something that you want your neighbors, your family, your friends, your cousins, and even the folks you don't like too much to hear. So let them know A Healthier Tomorrow is on the air.
Good morning, everybody. I'm also one of your co-hosts, Sierra Owens. It's a pleasure to be here today. Well, I'm excited. We're talking about healthy eating today and what it means to really fuel our body here, not only just on the historic West Side, but in general.
That's right.
What have you been eating lately? You've been eating good?
I love to eat.
Me too.
And yes, I've been eating real good. The summer was kind, so I lost a couple pounds.
Go ahead.
That's right. And I did it because I was eating a lot of fruits and vegetables. I was going up to the orchard, plucking my own stuff, going to certain farms, which we'll talk about in a minute.
Yes.
And enjoying some of the amazing food there. And it's just great to eat things that make you feel good.
Yes, because what you put in your body is ultimately what ultimately comes out. And I think it's important that for us to really dive in. And so as we sit there and go into our show today, I wish I could say I was eating as healthy as you will, but I found these honey bun donuts that I fell in love with. So I've been trying to limit myself a little bit. So I'm excited for our guests. So the Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion of Southern Nevada Health District. Learning how to manage your diabetes may seem overwhelming unless you know where to go for help. If you or someone you care about or don't even care about, all about living with diabetes or pre-diabetes, you can sign up for our free diabetes self-management and education classes to help you live healthier. So call 702-759-1270 or visit gethealthyclarkcounty.org.
Love that. And the way that you said that, I want to call.
I do too.
Oh my goodness. So without further ado, I want to bring on the air our first guest. She's no stranger to this audience or this show, Rayleen Earney from the Southern Nevada Health District. Good morning.
Oh, good morning, everyone. Nice to be here. Will and Sierra, thank you for the opportunity.
Absolutely. Well, thank you for always being an amazing guest and sharing such great information with our audience and just for the work that you do in the community in general. So I want to kick it off with just a real simple question. We're talking about diabetes management. So what is diabetes?
Well, as you know, diabetes is a chronic disease, but it occurs when the body doesn't have enough insulin, and so the body doesn't either produce it or it can't use it properly. So some doctors may say you're insulin resistant when you go to your medical appointment. So that's a problem. You don't have enough hormone to process that, to feed the cells the energy it needs so that your body is thriving. So the body breaks down the food into glucose, and that's where you get your energy from. So you got to eat healthier, for sure.
And so if someone is listening, they're saying, well, I wonder if this is applicable to me. Does this matter in my life? What would you say are some of the signs and symptoms they should be looking out for?
Being thirsty a lot, can't quench that thirst, and it's hard because we're in such an arid climate here in Las Vegas, so you don't know if it's diabetes or something else, but get tested. So that's certainly what you need to do. Being hungry a lot, and also cuts and sores that don't heal. That's something that people don't realize. Their circulation isn't good, so they get ulcers on the bottom of their feet, and then you have a big hole on the bottom of your foot, and so that's not good. Certainly diabetes, leads to complications as well. So it's always good to be tested and know what your blood glucose numbers are.
Thank you.
Sure.
All right. So Miss Rayleen, when we sit there and dive into this, I have two questions. One, where can someone get tested outside of like their primary care doctor? And then what are some things that we can do in order to learn more information about how to manage diabetes or even prediabetes?
Most healthcare providers, thanks for that, they actually test you for blood sugar, if you go to your appointments. But if you can't do that, then there are certain labs in town that you can ask them if they can test for you. So you can look those up and ask them what they need. But a lot of doctors do prescriptions. There are some health fairs that will actually test you. So in our community, Reach Las Vegas does a phenomenal job with the folks, with testing at the Mexican consulate, the El Salvador consulate. And so they, sometimes at a health fair you can be tested. So those resources are available on our website, gethealthyclarkcounty.org. So if you need to know when one of those events is taking place, you can certainly go on our website, and it's broken down by month. So that's a place to find out resources.
So if someone does not get diagnosed, they don't take this seriously, they don't go get checked, what are some of the long-term complications of unmanaged diabetes?
Yeah, unfortunately, unmanaged diabetes can lead to blindness and kidney disease, heart disease, and stroke. So it's really crucial that you get tested. And a lot of diabetes runs in families, unfortunately, so that risk is very high among people of color, unfortunately. But, we can all do a better job of getting tested. If you're 35 years of age or older and you maybe have risk factors in your family, someone has diabetes, or you just have those symptoms we talked about earlier, get tested. It's certainly worth it. It's better to know about it than put it off and not know about it. So I'm here to encourage you to go see a healthcare provider, because it's not too late and you can reverse pre-diabetes. But once you get diabetes, you can't reverse that.
I know Sierra wants to ask about prediabetes, but you said something that made my ears perk up. Did you say risk factor is being over 35?
Yes, they lowered that. It used to be 45 and up. Now It's 35 and up. So you know how national guidelines change over time. The American Diabetes Association is making sure they're catching even kids younger as 8 years old with signs and symptoms. Kids aren't getting enough physical activity, not eating the healthy foods. Unfortunately, they're getting diagnosed earlier. So 35 and up for adults is the new guideline for that from the American Diabetes Association.
I was real happy when I started this show this morning.
Oh, I'm so sorry. But there's always good news.
Okay, what's the good news?
Tell me good news, because I'm 36 and I'm like, okay.
The good news is you're paying attention here, knowing what to do, and then you get your resources and you can come to my class and learn about how to eat healthy and be physically active, and then, you'll be on the good side and you can prevent or delay type 2 diabetes. So that's the great news.
All right, so tell us about your classes that are hosted by you for the Southern Nevada Health District.
Yes, thank you. I do the classes, and they're free to those who either have pre-diabetes or diabetes. You can even bring a family member or a friend for support, and you just sign up on gethealthyclarkcounty.org, and even if you're a caregiver, we'll take you in as well. And those classes are very helpful. They're small group class, and it's 2 hours one week, and then the following week another 2 hours, and we give you so many wonderful resources. I know you can't see them on the radio, but I brought in a sampler recipe booklet that has anything from smoothies to breakfast foods to lunch to dinner. You can go on diabetesfoodhub.org, and that's from the ADA, and they list even recipes you can look up and print off for a later time, and it helps you know what the best things are to eat, and it goes over what's nutrition, the carb levels, and all that stuff. So that's really great, and they're available in English and Spanish. So my colleague David teaches classes in Spanish. Those are free as well, and he's got 2 classes in October. I only have one in English in October, but mine are October 30th and November 6th from 10 to 12, and you come to the Health District, 280 South Decatur Boulevard, and our cross street is Meadows Lane and South Decatur. We're right by the Red Lobster on the corner there. So
yes, love that place. Not that they sponsor the show, but I do enjoy eating there. And I'm going to take that cooking guide home with me, because that looks really good on the cover. Those
I brought it for you.
Dishes. Thank you so much.
You're welcome.
But I know they get more than just the healthy recipe guide. One thing I've started doing is eating off a smaller plate. I didn't mention that earlier. Instead of having my gigantic platter, I just have a little smaller plate, and I feel like I've eaten the same amount. So what else do they get with this?
That's perfect. So they get their free portion plate. It's not for the microwave, but it's something that can show show you portion sizes, half your plate with fruits and veggies. Then they get a fitness tracker once they complete class, tells you how many steps you took, to encourage physical activity movement. They also get stretch bands. And so let's say, it's been hot here in Vegas, so it's hard to go outside and get active. So you can stretch between commercials if you like to at your very own home. You don't have to join the gym, but if you join a gym, that's okay. Some medical insurances even cover that, like Silver Sneakers covers the YMCA. A lot of folks don't know that. And then the recipe sampler, you get low-cost clinics flyers, a certificate, and resources for help. A lot of people can't afford their medical prescriptions, so we give you low-cost clinics. The health district's listed on there with the pharmacy that we have. A lot of folks don't know we have a pharmacy for our patients. So those are all things that you get, and you get a lot of support from me and the group.
So I love the fact that there are classes and there are things where we can sit there and learn how to manage, type 2 diabetes and possibly prevent it. But what are some other things outside of eating off a smaller plate and being active that we can do to either prevent or delay type 2 diabetes? Because here on the show, we want to be proactive and
Absolutely.
not fully reactive.
So here at the show, you can even walk around the block, take your dog for a walk. Certainly physical activity is good. We talked about that. Healthy eating. I know more fruits and veggies, balancing your plate. You can go out to dinner and request things, grilled chicken, have low fat beef on a quarter of your plate. So we kind of divide the plate. We have a visual on the plate where half your plate are fruits and veggies, a quarter of your plate, your lean proteins, and also a quarter of your plate, your starchy items. And so that really balances. That way you're not taking out any one food group. You're not excluding anything. You're eating a well-rounded meal. And we also talk about eat at least 3 meals a day and then sneak in 2 healthy snacks between the big meals. And so we talk a little bit about carbs, but this is not a math class, so don't get scared. I want you to come to my class. You will just come, and we teach the plate method, but 15 to 20 carbs can be a healthy snack. Cut up apples with peanut butter can be a great snack. String cheese with whole wheat crackers, those can be another healthy snack. And we can't leave out beverages. You have to have your, not drinking the colas and all those sodas with the high sugar content in them. A can of Coke has like 40 grams of sugar in it. That's like 10 teaspoons. So we want to make sure you're drinking more water, iced tea without sweetener, and then, sweeteners in moderation, because there's been a lot of that on the news as well. So you got to look out for erythritol. Don't have that on your label there. So just want to throw that out there.
It's so tricky to find all the right things there sometimes. So that's why I do love water. I put a little mint in my water, a little lemon,
Perfect.
a little cucumber. Sometimes if I'm feeling a little adventurous, I'll put some pineapple slices in there. Just make the water
fancy?
good. Yeah, I'll be fancy.
Those are awesome. And we give you the recipes in our class as well. So we have a small card with all the recipes on there. Basil and watermelon can be one of the recipes.
Ooh, yes,
but you gave up a lot of those nice things. So, if you don't like regular water, we want to encourage you to drink more water, stay hydrated, and it helps with keeping blood glucose in a good range.
Excellent. Well, Rayleen, thank you so much, as always, for the incredible information. There are so many great things that you're offering our community. I hope folks really take the time to hear what you've said and take advantage of these free resources that you're offering, because health is wealth, and we only get one body, so let's take care of it.
My pleasure. Thank you.
Thank you.
Absolutely. So the Healthier Tomorrow radio program is brought to you by the Southern Nevada Health District Office of Chronic Disease Prevention and Health Promotion. Did you know that more than 80% of people with prediabetes don't know they have it? Prediabetes is a condition where your blood sugar is higher than normal, but not high enough to be diagnosed with diabetes. To find out if you're at risk, take the pre-diabetes risk test and sign up for our free online diabetes prevention program. You can find the pre-diabetes risk test and the Road to Diabetes Prevention class on our website at www.gethealthyclarkcounty.org.
All right. So I absolutely love our guest for multiple reasons. I've low-key been like stalking her out in the community. Miss Tameka Henry, who is a woman of many, many hats. Talk to us. Why are you joining us today, and how does it feel, the role in nutrition?
Oh my goodness. Thank you so much. I'm so glad to be here. And listen, I'm so happy to see you and see you too in person. Yes. Right? So I get to be here because I'm the proud executive director of the Obodo Collective.
Yes.
We are a local nonprofit situated here in the historic West Side. Our main mission is to help eliminate multigenerational poverty within our communities. And we have 3 pillars that we focus on right now, which is food insecurity, housing, and also education. And so I'm here today to share a little bit more about the Obodo Collective and our urban farm and all the happenings there.
Let me tell you, I was introduced to the Obodo Collective last Nevada Day. Teach for America, we did our day of service there, and we're doing our day of service there again as we pour back into Nevada. And when I say that was some of the best okra that I took home and made some okra and tomatoes, and the watermelon and everything was so amazing. And Miss Cheyenne, Farmer Cheyenne.
Oh my goodness. She is so amazing, and I am extremely grateful that we get to work alongside each other and with each other to help uplift our communities by way of growing fresh produce.
So you tell us about our mission. Tell us the history. How did it come? Because just hearing Miss Cheyenne talk about it and hear you talk about it in the community, our viewers have to learn.
Yes, so Obodo was birthed out of the needs that presented during the pandemic. So many neighbors, especially here in the historic West Side, didn't have access to food as readily as other communities. And even before the pandemic, there was a lack of access to fresh fruit and produce here in the historic West Side. Definitely a food desert, also a food swamp. So food desert, there's not many grocery stores in our area. And I'm thankful that Mario's Market has a bigger location and has more access to fresh produce. But in between there's not much when you're driving through the 89106. And so we just wanted to make sure that we could be that beacon of hope in the desert. And so we have the urban farm. It's a half acre of land where we have 26 raised beds where we plant food. There's 26 fruit-bearing trees along the perimeter. And it was something that we did with the community and not to the community or for it. We asked, what is it that you want? What is it that you need? What items would you like to see grown here? But also we invite you all in to come and plant them with us and harvest when it's time to. And so I'm just extremely thankful of the support that we have gotten from the community by way of attending our gardening classes that we have, and even some of the special events that we've had in partnership with Roseman University and Arcos Health. We've had sunset suppers where the community can really come together, learn about food and nutrition, have a chef demonstration with amazing food, and shout out to the Edible Bunch and Chef Stacy from Simply Pure, and even Danielle from the Taste Juice Bar, where we were able to have all of these plant-based and vegan options that were so tasty that the community typically don't have access to. And so that's what Obodo is. The Obodo Collective is just, we've built this hub in the historic West Side where community can come together. We really want it to be a space for family and community engagement.
So tell us about some of these classes that you mentioned and workshops, because it seems like I need to get there, because what's the statistic about being able just touching the soil, how it helps lower your blood pressure?
See, now you want Cheyenne to come in.
She said, "Let me stay in my executive director lane, Sierra."
No, it's all good.
You.
Like I'm trying to channel her, but yeah. So, but no, I just want. So for me, like being hands-on, come and see for yourself. You are always invited to come to Obodo and put your hands in the soil. You'll tell the difference immediately. Like I've seen so many individuals, because we are in an area where there are a lot of houseless individuals and those who are suffering and struggling through mental health issues and addiction, but they come into our space and they're willing to have conversations with us. We're building relationships, and we are able to share resources with them if and when they're ready to change and transform their lives. But we have to welcome them with open arms, because you don't know what an individual has been through. But when you build relationships with them and you build that trust, they're more willing to take the information that you're willing to share with them and then act upon it. And so I'm extremely thankful to be in a position just to be that vessel for them.
I'm sitting here and I'm like, I'm supposed to be asking questions, but I'm just mesmerized listening to, this amazing work that's happening, but also the way you present it and your spirit and energy. Like it might not just be the dirt. It might be you that's lowering people's blood pressure. So we'll see. Tell us a little bit about your green grocer that's opening.
Oh my goodness. So we do have the pop-up markets that will start up later this fall. The summer was a little brutal.
Just a little.
That's a little brutal. And so we didn't produce as much produce as we would have liked to, but this fall we're going to be ready. And even right now, the okra that you spoke of.
I need to come back.
Yeah, you need to stop by on your way home, please, and thank you.
I got you.
The okra was like, "Oh, I'm here for the sun. I'm here for the heat." Yeah, she was the plants were dancing. And there is plenty of okra. So any of you listening, please come to 1300 C Street, right in the heart of the 89106. We do have okra on deck, and it's ready for you.
I'm going to come get some for my gumbo.
Yes, please do.
It was so good.
Yes. And so, the outdoor space. So we do the pop-up markets, but what we really want to bring to the community is this green grocer, where we have not only the items that we produce at the farm, but we also want to source locally from other farmers, and also have those prepackaged options from Simply Pure and Chef Stacy. She has this amazing coconut kale salad. If you have not tried it, I encourage you to reach out to her. And also, she does a pop-up at Mario's Market on Mondays, Meatless Mondays, from 5 p.m. to 8 p.m., where you can get your amazing plant-based foods. So we do want to have those offerings in our store at a price point where it's affordable for individuals in the community. And so we are hopeful to have this store opened by mid-November. We're going through all of the processes to get our permitting, and you all will be the first to know when the grand opening is, because we will invite you.
Oh, yes, we showing up. My mom already texted me right now telling me, "Grab me some okra, please."
Yes, please, Mama. The okra is on its way. You don't even have to worry. We have green and red okra available.
I've never had red okra.
Oh, you gotta have it. Oh, she's so sexy.
Oh.
I'm gonna try some of this red okra myself.
See, there we go. We gotta look. I gotta sell the produce.
Yeah. As we come to our last couple minutes together, I just want to hear from you. Kind of, why is this so important for our community? Why is eating better so healthy? Why is getting engaged with nature and gardening so important? And why is community so important?
Community is so important. First of all, we all we got. we have to look out for one another, and Obodo literally means community in Igbo. And I think that it's important for us to continue to host our classes. We always have a multi-generational lens. We want our families to learn together. It's important that we model what we want our kids to see. And so when they see parents gardening, they may want to do it too. When they see parents eating healthier, they may want to do it too. But also just making sure that our communities are informed and educated on how to do that. Because oftentimes, I'm plus size and I'm proud of it. Yes, I'm happy. Right? But also just teaching those, like, eat to the way you move to the way you eat. Making sure to increase your produce intake, fiber intake. Your gut health is important. And I thank you for bringing information about diabetes. So even for myself, my husband has had diabetes, and he has a chronic illness, gastroparesis, which he was diagnosed with in 2006. Now, had he known that he was diabetic or paid attention more to those pre-diabetic signs, who knows where we would be now. But we're here. He has gastroparesis. Sometimes he doesn't digest food properly, and it lands him in a hospital. And even at our sunset supper, his first time having a salad was with Chef Stacy.
Wow.
Because he just doesn't like salad, doesn't like the way it tastes. And it's like, no, you got to try this. And so now on Meatless Mondays, guess what he's asking for? He's asking for a kale salad. And where was he introduced to it at? A sunset supper that was held at Obodo Collective. And so it's important for us to make sure that we are bringing exposure to those options and just heal holistically. It's about the food. It's about the movement. It's about meditation. It's about yoga and experiences. So Obodo is here in the community to be that hub for health and wellness for the whole family. And we're looking forward to having you.
Well, we are so grateful that you joined us on A Healthier Tomorrow today, and you're educating us about nutrition. And in the next role, you're going to help all our kids have better education. So I'm just going to leave that there. And we've got some community events coming up.
Real shameless plug, real quick, because Obodo is community. We are going to be supporting Matt Kelly Elementary School. They're building a new community garden, and they need more hands on deck. And so Cheyenne will be at Matt Kelly this upcoming Saturday, and I believe it's at 8 a.m. And we would love to have you all come out and visit us. So visit our website at obodocollective.org. Also follow us on social media at Obodo Collective. And we hope to see you on Saturday, October 12th at Matt Kelly. It's a community day of giving, and it's 7 a.m. to 11 a.m. And we will be building them a community garden.
I love that. I absolutely love that. On top of that, we have one more event. The center is doing Building Bridges to Health. It's the HIV Health and Wellness Summit 2024. It's for BIPOC communities moving forward together. It's next Thursday, October 17th, 2024, from 9 a.m. to 4 p.m. There's going to be panels. There's going to be workshops led by some amazing community leaders and community activists and just people that are pouring into us, including Miss Yvette Howard, LCSW, who will be teaching attachment styles and how to dive in. So please join us at the Center for Building Bridges to Health.
Awesome. Well, great information. Looking forward to that event at Matt Kelly and at the center. This has been A Healthier Tomorrow. I am Will Rucker.
And I'm Sierra Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. We'll see you right here next time.
All right. Have a good day, y'all.